Hi, I'm John, your host, and welcome to Heart of Care, a podcast by ANCU. Here, we delve into the real voices of healthcare, sharing stories of resilience, humanity, and the unwavering heart that drives it all. Join us as we empathize, learn, support, and even find moments to laugh together. Thanks for being here.
Heart of Care, Season 2, Episode 5. Title: Why We Do What We Do. Bulk Billing versus Private Practice. Subtitle: Two Models, One Mission, Making General Practice Work. Welcome to Heart of Care, a podcast about the human side of healthcare. The choices we make, the systems we navigate, and the people behind the practice. I'm your host, John. You're listening to Season 2, Episode 5, titled Why We Do What We Do. Bulk Billing versus Private Practice. Today, we're diving into a question reshaping general practice across Australia. One that's dividing clinics, confusing patients, and pushing many GPs to the edge. Bulk billing versus private billing. You've probably heard things like, "I don't do 5-minute medicine," or worse, "I'm better than a bulk billing doctor." But what's really behind those comments? Is this about quality, or about survival in a system that's been underfunded for far too long? Let's get to the heart of it. Joining me today, Dr. Evan Hope, a GP committed to bulk billing, serving a high-demand community where access is everything. Dr. Sophie Chan, a private billing GP who focuses on continuity, longer consults, and deep therapeutic relationships. Segment 1. Why we chose our paths. Evan, let's start with you. Why have you stayed with bulk billing when so many others are walking away?
It's not easy, but I work with people who simply can't afford out-of-pocket fees. For me, universal access isn't a slogan. It's a principle I live by. Bulk billing doesn't mean lesser care. It means frontline medicine. Yes, the time pressure is real, but so is the need. Just the other day, a man came in with what seemed like a chest infection. 10 minutes in, I realized he was in early heart failure. That kind of vigilance is what bulk billing demands.
Sophie, what made you move toward private billing?
I was burning out. The high-volume pace was unsustainable, and I knew I couldn't keep going without breaking. I wanted to offer care that was slower, deeper, and more personal. And private billing made that possible. Last week, a woman booked in for contraception, but what she really needed was space to talk about her partner's emotional abuse. That wouldn't have come up in a rushed consult. The time made the difference.
So, two very different models, but both grounded in care and ethics. Segment 2. 5-minute medicine? Let's get into that loaded phrase. I don't do 5-minute medicine. How do you both respond to that?
It's a complicated one. I understand it's meant to critique the system, but it can come off as dismissive. Bulk billing GPs are often working under impossible conditions. They care deeply. They just don't have the luxury of time.
I agree. And not every consult needs to be long. A straightforward cold. You ask the right questions, check vitals, do a focused exam, and decide antibiotics or not. That can take 5 minutes or 10 or 15. It's not about the duration. It's about thinking clearly and acting responsibly.
So the issue isn't rushing, it's streamlining.
Exactly. In a bulk billing clinic, I might see 10 of those cases in a morning, knowing that one might be pneumonia or something worse. You stay sharp because there's no room not to.
And in my space, we go deep. One symptom often leads to a mental health check, a cervical screen, a conversation about relationships or stress. That kind of care needs time. Both models are responding to different but valid needs.
So it's not a hierarchy. It's a spectrum of care.
Exactly.
Segment 3. Emotional labor and adaptation.
There's a myth that bulk billing means shallow care. That's simply false. I've sat with patients sobbing in front of me, revealing trauma they've carried for years. I've stayed 40 minutes with someone mid-crisis because it was the right thing to do. But the system doesn't support that kind of time. To survive, you adapt with efficiency, prioritization, and clear clinical judgment.
And the emotional labour is everywhere, in both models. Patients don't see the after-hours paperwork, the follow-ups, the recalls, the worry that stays with us. It accumulates quietly but relentlessly.
Especially when your clinic is the only accessible option. My patients can't pay privately. They can't wait 3 weeks for an appointment. If we shut, they're left behind. High volume isn't a sign of greed, it's a sign of duty. And here's the thing, the value of care often comes down to expectations. If someone walks into a bulk billing clinic expecting a relaxed 20-minute health chat, they might feel let down. Not because we don't care, we care deeply, but because we're operating in an underfunded, overstretched model. We triage, we act quickly, and we make it count.
I want to add this. I don't agree with private billing GPs who look down on bulk billing clinics. That kind of belittling helps no one. We're all working within flawed systems, ones we didn't design. These are systemic issues, not personal failures. Respect must go both ways. When I talk to patients about visiting bulk billing clinics, I encourage them to come prepared. Focus on 1 or 2 key issues. Know that your doctor is doing their best in a limited frame. Compassion isn't measured by time, it's measured by intention.
It sounds like both of you are holding different ends of the same responsibility. Upholding accessibility, equity, necessity, and quality. Not competing, but complementing.
That's right.
Segment 4. What if bulk billing disappeared? Let's run the scenario. What happens if bulk billing disappears completely and every GP goes private?
Chaos. Clinics would shut. Emergency departments would flood. Vulnerable patients, refugees, the elderly, low-income families would vanish from care.
And private billing clinics couldn't absorb it. We rely on bulk billing clinics to catch what we can't. If every clinic charged out-of-pocket fees, the entire ecosystem would collapse.
So it's not a competition. It's a fragile coexistence.
And we're losing that balance.
It's already happening. Bulk billing rates are dropping, especially in the cities. That's not a trend, it's a warning.
Segment 5. Personal models of care.
I tend to attract women, often juggling work, parenting, perimenopause, mental health. They come in with multiple concerns, often layered over years. I know their families, I know their stories. That continuity is therapeutic, but it takes time, and private billing gives me the space to honor it.
And we need doctors like Sophie. That depth, that continuity, that's what keeps people well in the long term. My work is often the first line. Fast, reactive, essential. Her work is long-term, preventive, stabilizing. We need both ends of the spectrum.
Final reflection. What I'm hearing is this. We're all trying to keep the same thing alive, just from different directions. Bulk billing GPs like Evan are holding up the system under enormous pressure. Private billing GPs like Sophie are building sustainable spaces for complex care. Now imagine if Medicare rebates actually reflected the reality of general practice. Its complexity, its risk, its relational depth. Then Evan could bulk bill without burning out. Sophie could reduce gap fees, and patients could get the care they need, regardless of income. Fair funding doesn't just protect clinics. It reduces hospital strain, improves outcomes, and keeps the heart of healthcare beating. Because it's not bulk billing versus private billing. It's all of us versus a broken system. Thanks for joining us on Heart of Care and for listening to Why We Do What We Do. Season 2, Episode 5. Whether you're a GP, a policymaker, or a patient, this conversation belongs to you. If this episode sparked something in you, share it. Talk to your colleagues. Write to your MP. Ask what they're doing to keep general practice alive. Until next time, Stay kind, stay curious, and keep asking the right questions. Thanks for tuning in to this episode from AMCU Media, where real stories, healthcare, and advocacy come together. We release a new episode on the 28th of every month. We're a small, independent team doing our best to bring you meaningful conversations. And your support means the world to us. Subscribe to our YouTube channel and Facebook page. Just search for AMCU Media. Got a story or topic to share? Email us at amcu@strmedical.com.au. Together, we can do better. For care, for community, and for change. Until next time, thank you. And take care.